Well, good afternoon, everyone, and welcome to our very first seminar series of the year. We've chosen a really interesting topic for you. For those of you who haven't met me yet, I know there are a lot of new students. I'm Heather Stewart. I'm a professor in the Department of Public Health Sciences, and my work is in the area of mental health. And it's interesting because we have a mental health-related panel this morning. We're going to be talking about stress. And before we do that, I'd like to just start off with a land acknowledgement. And we'd like to begin our work today by acknowledging that Queens is situated on the traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands. We thought that a panel dealing with student stress and wellness would be a very good thing to do early on in the year before the stress hits you, so that you're going to know what to do when it comes along in a tidal wave. Around midterm, I think, is usually when people start to feel it. And we have three really great panelists today who are working in various areas of student health and wellness. First off is Dr. Ann Duffy. She's a professor in the Department of Psychiatry, and she's the director of the new Youth Flourish Center for Student Mental Health Research, and she'll be talking a little bit about that. Congratulations on that accomplishment. Next, we have Dr. Brooke Linden, who is a graduate from our program. She's an adjunct assistant professor, Department of Biomedical and Molecular Sciences, and she's also a research scientist in Health Services at Policy Research Institute, where she works with me on my research team. And finally, Dr. Stephen McNiven, who is an assistant professor in the Department of Psychiatry and founding director of the Division of Student Mental Health. So each one of the panelists is going to come and tell you a little bit about themselves and what they do, about 10 minutes. And then at the end, we want to have time for discussion and questions. So without further ado, Anne, I'll ask you to come up.
I feel like I'm in the starting blocks here because I have lots of slides, but my goal today is to give you folks an overview of really what is Youth Flourish and what does this research, how does it fit in to translating into resources to support student well-being, but also to give you a taster for the type of data we're collecting in case anyone is interested for their academic work, for example, their undergraduate thesis or master's or PhD work, because we've just received funding for a new center to bring this work all together. And there is some, it's always limited because we're in a Canadian environment, but limited funding for studentships. So if you're interested, you can contact me after. So can I just put this on here? So, okay. And basically, as Heather said, I'm an academic psychiatrist. So I trained in psychiatry. I didn't get into medical school until after 4 tries. And I got in off the wait list in August. I remember packing my bags and hopping on a train to go to Calgary. And so I've been so thankful. And it turned out it was a good thing I didn't get into medical school right away because I did graduate work. And so that was really helpful for me because then I've never sort of thought about things the same way as I would have had I not done that graduate work. Like, why is this happening? For who is this working? Why isn't it working? And those kinds of questions. So I'm very thankful for that, what seemed to be a setback initially in my career. And so I'm also with the University of Oxford, and we have taken this research that I'm going to show you and translated it across 5 or 6 UK universities. And now we're trying to go across the country. So it's really exciting time. So first of all, the buttons aren't working. Let's see. Okay, stop the clock. Okay, now I'm good. So why are we interested in mental health and well-being? Well, what we know is that most psychiatric disorders, we're not talking about symptoms, but disorders, actually occur in adolescence and early adulthood. And this is World Health Organization data just showing all the various common mental health conditions, and you can see how they peak over the course of adolescence and early adulthood. This is data from the UK because they actually have a higher education data registry across the entire UK, so they can tell who are students involved in higher education versus who are general population of young people not in higher education. And they looked at suicide rates, completed suicide in students versus non-students. And you can see on the right-hand side that the orange bars are students, so the suicide completion rate is still lower than in the general population of young people, but does peak over certain times of the academic year and actually is increasing. That's the graph on the left-hand side, commensurate with increases in the young people's population. So it's not that suicide rates are higher in university students, but they are increasing as they are in the general population of young people slightly, not exponentially, but there's certain peak periods of risk through the academic year that we know about and we could be thinking about in terms of prevention and early intervention. You have probably, as students, heard a lot about student well-being and mental health, and the fact that this is an increasing concern not only for students but for universities. What should we be doing? What's our role as a university? How can we help students? And why is that happening? Well, it's probably a combination of a number of things. So number one, I mentioned to you that coming into university, this is the peak period of risk for the onset of mental disorders. But most students who present for help do not have a psychiatric illness, a mental disorder. Most students have symptoms, and the symptoms are still problematic because they can still be distressing and impairing, and oftentimes related to the stress of the transition to university. And that can be related to leaving home for the first time, having to make new friends. Your brain is still very much neurobiologically a work in progress, but we're telling you, you're adults, figure it out, look it up online, go get your syllabus, like organize your life, make good choices, but actually your brain is still very much under development. And those making good choices and anticipating the consequences and kind of higher level executive functioning is very much still a work in progress. And then there's all the existential angst of your time, so climate change, sustainability, the various geopolitical pressures that are in the world. And so all of this comes together with increased competition and perhaps less of a rosy economic forecast. So I think those are all concerns that you're probably well aware of. There's been a number of authoritative papers in the UK and across Canada identifying what are gaps in evidence that we need in order to really put evidence behind what we're doing to support students. So we needed a holistic system of support that was joined up. We needed it based on the evidence, we needed it based on testable theoretical models, and we needed large-scale reliable data. So in 2017, I was doing high-risk research for children at familial risk of serious mental illness, and I had branded that Flourish because most of those kids actually did well. And then I was asked by the Dean of Medicine, because of a review at Queen's, would I get involved in researching student well-being and mental health? And we ended up branding that Flourish. And this is research to address those knowledge gaps in partnership with students. So not for us, but without us kind of thing. So we started off, we had 30,000 Canadian dollars. That's all we had for budget. So students volunteered. We started off with an electronic survey called the Flourish Student Wellbeing Survey. You will see this coming out this fall. It's different from all the other surveys because it's longitudinal. So we have epidemiological level data for over 10,000 Queen students since 2018, following those students as you enter university in the fall, and then following up with students in the spring, and then following up again the subsequent year, and so on and so forth. And then we have a new cohort of incoming students. So I don't know if it's a real term, Bradley could probably tell me, but I call that a successive cohort study, because it's a longitudinal cohort study that keeps enrolling students each academic year. And we wanted to know what were the student well-being and mental health concerns, what was the burden. We wanted to explore trajectories and mechanisms, and we wanted to identify places where we could intervene. You can see some of the data that we could use validated measures, and we could see from fall to spring symptom levels increase generally in students. You can also see that symptomatic students tend to have symptom clusters, so self-harm, anxiety, and depression go together. You can see that students who screen positive tend to screen in the fall, screen positive in the spring. So this tells us clinically that it's not going to go away. It's not a wobble. It's not an oops. We should be intervening earlier rather than hoping things just get better. We also found that university connectedness was an important risk and protective factor. So students who indicated a low sense of being connected or membership in the university tended to develop symptoms. Students who had a high degree of social connectedness and membership in the university tended to have an improvement of symptoms over their first year. And we know that substance misuse is a major risk factor for not doing well emotionally or academically. So I can talk about this all day, but do not use cannabis regularly. It is not good for your brain. It is not good for anxiety. What we were able to do, because this was digital, we were able to continue this research over the course of the pandemic. So we have pandemic data, continuous data, looking at how symptoms changed as pandemic-related conditions changed on campus. And you can see anxiety and depressive symptoms increase. Substance use decreased, interesting, because there were less social opportunities. We've modeled sleep because sleep is a major pathway to difficulties academically and emotionally. And you can see each color is a new cohort coming in, and you can see sleep quality worsens over the course of the academic year, but has never gotten back to pre-pandemic levels, which is interesting. We looked at risk factors, holding constant, adjusting the models for remote risk factors we couldn't change, like family history, previous lifetime history of psychiatric illness, early adversity, abuse, neglect. We can't change those things at university. We know that they predict for mental health and outcomes. So adjusting for those mathematically, we looked at proximal risk factors at entry to university that could identify targets for early intervention. And we found that, of course, substance use, sleep, regular exercise, social connectedness, self-esteem, and perceived stress were all important targets predicting outcomes in students over their first year. We then got funding to continue this work from the Mont Gainsland Foundation. They said, okay, right, you're collecting all this great data. We want you to do something with it. We want you to distill it into resources. So we followed a step care model, meaning stepping up to levels of intensity as symptom levels increase. And we did an accredited mental health literacy course, IDIS 199, which is offered, a full semester course offered for credit as an interdisciplinary elective. And it's to teach students about their mental health and well-being. What are early risk factors? How can they develop healthy socio-emotional coping resources, and how to signpost to help? And what are the theoretical models underneath all of that? And then we also created an app, a digital well-being app with Oxford, the You Flourish iSpiro app, which I would invite you all to check out. We've adapted it to be a student-facing one-stop shop, signposting students, giving positive feedback about where you might go if you develop symptoms. And also you can share your dashboard with any provider locally or in your home environment. So the You Flourish survey, as I mentioned, we've continued it, and each year is a new cohort of students, and we have over 10,000 Queen's students now taking part in this survey. So we have really nice data, and it's very rich and validated measures. So if anyone wants to do an analysis on this data, please do contact us. We also have our mental health literacy course, which is broken into 6 modules and uses all kinds of cool pedagogy to help students learn and onboard knowledge. And we were able to show actually an improvement in mental health indicators and mental health literacy and in students who took the course, but also in comparison to the broader You Flourish survey. And we have student stories, and students told us what they really valued in the course. And then we have the digital well-being app that I mentioned, so look out for that. And this is about student engagement and acceptability, and how students perceive barriers in access to care. We're also looking at transitions to and through care and have data on that. And now we're working with several UK universities across several disciplines looking at theoretical models. And I'll just end here. So all of this work has been individual grants, and now we've just gotten $3 million from the Rossi Foundation to create a hub, a center, which is essentially a virtual center, although we have one office here. And it has a stream for training students in student mental health research across disciplines, to develop tools based on the evidence, and also to translate findings into policy. So we'll be tapping some faculty on the shoulder to help us out with and advise us on this endeavor. And I just wanted to thank you for your attention and acknowledge my collaborators.
So hi, everybody. I think as Heather mentioned in my intro, my name is Brooke Linden. I'm a PhD graduate from the Department of Public Health Sciences. This is the second one of these that I've done, so happy to be here. First time I've had slides, so hopefully I remember everything I'm supposed to say. So like Anne, my research is also in post-secondary mental health. I focus really on stress as predictors of mental health outcomes. So I focus more on sort of the front half of the equation, which Anne's given such a great overview of sort of the state of student mental health in Canada. and the UK for that matter, that she's done a lot of my intro work for me, which is fantastic. As Heather mentioned, I work as a research scientist for HISPRI, the Health Services and Policy Research Institute here at Queen's. I'm also an adjunct assistant professor across a few departments, including this one. Can I turn up my mic? I'll just hold it closer to my face. Just turn it on. Turn it on. Yeah. Turn it on. That's helpful.
Thank you.
Okay. Sorry about that. So I'm going to talk to you about two of my main projects today. The first of which is actually the work that I sort of began during my doctorate work to satisfy the requirements for that degree that I continue to sort of develop through my postdoc as well as through my current position. And the second one that I'm going to talk about is definitely related to this one because it really grew out of this one as a result of this work as well as a result of the pandemic. So I began work in student mental health about a decade ago when I was doing my master's degree. And at that time, there wasn't a whole lot going on specific to student mental health. So of course, we had research regarding adolescent and child mental health. We had research starting to happen a little bit more fulsomely with respect to workplace mental health, but there wasn't a lot that was happening specific to students. And that's what I was interested in. So when I went to complete my master's degree, I started to look for measures thinking, how am I going to assess student stress? What am I going to use in this survey that I'm going to send out to students, which by the way was pencil and paper individually collected. Thank you very much. 2013, everybody. And I found that there really weren't very many measures out there that I liked, and I didn't like them for a lot of reasons. Most of the reasons had to do with they weren't very well developed. They didn't involve student input, and that really rubbed me the wrong way as somebody who was also a student. So that seemed strange to me that students hadn't really been consulted in the development of a lot of these instruments, and they also didn't have very good validity and reliability statistics to go along with them, which suggested they might not have been measuring student stress especially well. They might have been doing a good job at measuring sort of stress more generally, more globally, but for this specific population, it wasn't really cutting it. So for my doctorate work, I decided to create my own tool. And what I began to do and what I continue to do with all of my projects in my program of research was develop it using a model that I called 4 students, 5 students. So I didn't want to be at that point, almost graduated graduate students sitting at my desk thinking, I wonder what first years are stressed about these days. So instead, I collected qualitative and quantitative data from students across levels, areas, and when I say levels, I mean like years of study, but also I talked to undergraduate students who were in their first year all the way to their 5th. We had PhD students, we had master's students involved, and asked them to tell me what stresses you out. Then we took that wealth of data and basically, for the sake of time, whittled it down, tested it for validity and reliability, and ended up with a 46-item index called the Post-Secondary Student Stressors Index. So this tool, as I said, was created with students from the get-go as co-creators, collaborators, whatever you like, of the tool. And it covers those 46 stressors across these 5 domains that you see on the screen. So academics, learning environment, campus culture, interpersonal, and personal stressors. The other critique that I had of existing student stress measures was that they were really focused on academics, because when we think student stress, we think exams, we think multiple assignments and things like that. But the thing is that students are actually human beings. So there's more going on than just the academics. I'm sure that you guys have seen something similar to this in your EPI classes. You might have seen it represented as like a funnel or a bathtub. So this is meant to demonstrate the relationship between incident cases and prevalent cases. So you can see in the sort of bulb of the funnel, the vast majority of the cases that we're looking at here are prevalent, meaning that they pre-exist. In this moment, that's the number of people with a disease. Incident cases are newly developing cases that you can see coming into the funnel and sort of adding to that mess that we already have there in terms of the wealth of prevalent cases. And then you can see at the bottom, actually it's a little covered by the Zoom thingy. So you can see at the bottom we have in this sort of narrow channel the escaping cases that are resolving. So when I say resolving, I mean either they're ending in deaths or in cures. So in the context of student mental health, the prevalent cases are those pre-existing mental illnesses or pre-existing approaching mental illness. So as Anne mentioned, these students that are experiencing symptoms, they may not have quite reached that clinical threshold yet for sort of an official psychiatric disorder that would be diagnosed by your doctor, but they are certainly experiencing symptoms. So these could be students that are incoming to university with an issue that already existed.
or these are students who are in their first, second, third year that at this moment in time are experiencing symptoms of psychological distress. The incident cases are the ones that we want to try to prevent, right? So those are our newly developed symptomatic students that we want to try to get ahead of, as Anne was saying. The triangle here, pyramid, whatever you'd like to call it, is meant to demonstrate what Dr. Duffy also alluded to, which was the sort of range of services or supports that we can offer by level of intensity. So these are separated into upstream and downstream services. That might be language that's familiar to you guys. Maybe, no, some head shakes. Okay. So upstream services are meant to intervene prior to the development of symptoms. Downstream services are the ones that seek to, I was going to say cure, but not necessarily cure, but improve quality of life, those sorts of things. Those are our treatments or early detection. For these services, these are sort of seeking to reach out to students that are already symptomatic. So what I wanted to do with the PSSI was create a tool that would help institutions to intervene early and really focus on that upstream services piece. Because the problem is, as you guys know, as epidemiologists and future public health professionals, if we aren't doing anything about the incident cases coming in, we will never have enough money to throw at treatment to effectively get rid of what's sitting in this funnel, right? We won't be able to address all of the cases if we're not doing anything to prevent new ones, incident cases, from coming in. So my work really focuses on that upstream part. And as I mentioned, I focus on stress because we know that stressors, chronic stress in particular, is a predictor of the development of mental illnesses down the road. So in 2020, 2021, which was not the most ideal year for this to happen, for reasons, we were able to release the tools. This is my postdoc work now, across 15 institutions in the country. We had a great uptake, shockingly, which is also slightly covered here, but it was a total of about 12,000 with all 3 data points combined. And this gave us some great data that we could look at here. You can't really see the average lens for some reason on this slide. This is meant to show a quadrant graph where the lines represent mean severity ratings and mean frequency ratings. So when students fill out the PSSI, they're asked to rate each stressor by a level of severity experienced due to that stressor, as well as the frequency with which they experience it. I felt like that was an important sort of dual aspect to have, because it's not only, I don't only want to know which stressors are causing students a lot of stress, but I want to know, is this something that's bothering you all year long? Or is it something that's an acute stressor? Do we see exam stress happening only at exam time? Or is it something that nags at you all year long? That can inform policy. So in the upper right-hand box here, this is sort of what I like to call the low-hanging fruit. These are the above average by severity and frequency stressors. So they're causing the most stress and they're happening the most frequently. One thing to keep in mind, because this study was conducted during the pandemic, all of the data has to be interpreted through that lens. So you can see we have like a clustering of financial stressors happening, your academics are there, but also things like, I'm not working hard enough, probably because people weren't on campus. We saw a lot of the self-care items, like worrying about having enough exercise and not enough sleep, right here. I'm worrying about my nutrition, cooking my own meals. These were things that in the pilot test the year prior had been actually quite high for students, particularly incoming graduate students for second years. This year, they were quite low because everyone was at home. This is the same graph, just fasted differently. So all of this led into the development of Canada's Student Mental Health Network, which is an online one-stop shop portal that's created for students, by students. All of the content on it is originally created by students and then reviewed by subject matter experts to ensure that everything's evidence-based. It's split into these 3 sections of learn, connect, and access. And it really came out of everybody was online during the pandemic, so I thought, what can I do to support students when no one's on campus? When most of the promotional resources that you guys have are on campus, not a lot of those were online. So I came together with a group of students that had either, TA'd or RA'd for me in the past and asked them what they thought about this idea, and they really just ran with it. So this has been sort of in production since 2020, really officially released 2021. We've undergone an initial evaluation that's had great reviews, so I would encourage you to check it out. And if you have any questions about it, I'm happy to answer them.
Yeah, sorry about the mask, but we're having a little bit of a outbreak of COVID-19 among the staff at the student health service right now. Yeah,
It's good, I'm working remotely.
yeah, well, it's depends on what I'm gonna do tonight. Anyway, I've been working at student health at Queen since 1988 and now retired. And one of the legacies of that prolonged tenureship was 51 boxes of files that are sitting in my basement because we don't know quite what to do with them. So Anne came up with an idea of what we could do with it. I worked with a historian in UK and looking at the historical antecedents of all what we're dealing with today. It's going to do an acknowledgement, and I think it's already been addressed, but I think it's also helpful to once again reflect on the importance of where we are, where we're studying, and who's led around. And I mentioned conflict of interest, which is basically reporting on myself. So when I was growing up in Kingston, I heard a great deal about what's called the Kingston Conference. And the Kingston Conference was a 1960 Liberal Party gathering, which was fundamentally transformed the country. From that came Medicare, from that came the pension plan, and a number of other innovative strategies that swept through Canada in the 1960s. The picture there is Ben Henson, who Nixon became the finance minister under the Trudeau government. There's the Legends Affairs minister, and that's my dad. That's why I know a lot about the Kingston Conference. But there was another Kingston Conference, and again, another that had a fundamental role in reshaping the landscape of student mental health across the country. And that was in 1963. And I came at Queen's University through the concerted efforts of a lot of people who had nothing to do with Queen's. So that's important to recognize, because that's the pattern we discovered, is that so much of what we see has come from active work by others. And I think that, so at this conference was a collection of administrators, psychiatrists, clerical people, all kinds of people from all sorts of environments, and maybe a few students, but it came initially from the efforts of the National Union of Students and the Canadian Health Association. And they managed to find some funding, and they put this on, and some very important people in the future of the Department of Psychiatry at Queen's attended that meeting. Some of them were just residents at the time. And but before we talk about what they transformed, let's just reflect back to what was there before. And so in the Canada was quite behind in developing student mental health services, and even further behind in developing any kind of health service at all. It was really in 1921 that Queen's appointed a physician, a university physician, to provide health care for Queen's students at the time. And they were based out at Edmonton Hall down the road there. And it also included a nurse who could come and visit some of the students in their residence rooms in 2 rounds. And that stood for many years. And in terms of psychiatric care, that started showing up with Dr. McQuaid. Now, we may include Dr. McQuaid because he was also the head of the asylum here, the Rockwood Asylum. He was essentially a one-person department of psychiatry before there was a formal department of psychiatry. He's also the great uncle of Peter Milliken, the longest-standing Speaker of the House of Commons, and also at the end here in the constituency. But McQuaid was just going flat out, and he campaigned for, among other things, the creation of an academic department of psychiatry things, but also campaigned very strongly for the formal development of a student mental health service. And he carried this burden for many years of trying to do everything. And it wasn't just seeing students in distress, but he was also reaching out and trying to address the preventative issues and sort of the same stuff that we're talking about already today. how do we intervene early rather than too late? Because in those days, if people got into trouble, they basically left the university. That was pretty much the only option they had. And a source of great loss. So if we think back to the 1960s, at that time, 25% of people never finished their university education. And that was estimated to represent a loss just in tuition of about $100 million a year. In surveys at the time, 1 in 5 students were so distressed that they needed psychiatric care. 3 of those 100 would have great disruption in their studies. 1 or 2 people on campus would kill themselves every year. And that was sort of widely understood as just part of the life of the university. The study that Anne and I and Sarah Cook are doing right now also reflected on what's going on in Oxford around that time. They had 11 suicides in 1 year. And that's not a very big school. But again, pressures that were on students were enormous and continue to be enormous. So from that came the student health services we know. Dana Farnsworth and Graham Blaine were 2 psychiatrists from Harvard, and they came to the 1963 conference. And they spoke a great deal and really set the tone for what was to follow. And both of them talked about building this integrated mental health service on campus, working in close collaboration with other memberships in the community, working very hard to not only provide services directly for people when necessary, but to try and intervene at various levels. And a lot of the focus then was on academics and the pressure students faced in meeting those academic obligations, but there were obligations that came from the financial state, the changing demographic of universities. There was a massive expansion of the number of people attending university following the Second World War, and a greater diversity in who was coming in terms of gender, ethnicity, family experiences. More and more people were coming who had no one in their family that was at the university before, and often coming on grants or scholarships that required they continue to perform at a high academic level, and all in all making a perfect environment for stressing students out completely. So the big change came. So this is the new student health service. That's Dr. Upton, that's the secretary. They have converted house on Stewart Street, and that became the new student health service. And interestingly and importantly, the first director of the student health service was a psychiatrist. Anyway, so we contrast staffing at the new student health service. So up before, like 1963, there was the university doctor who had an 8-month contract, and Dr. McQuaid running around trying to do a million different jobs at once. But now we have a psychiatrist director, we have a part-time clinical psychiatric assistant, 2 resident trainees in psychiatry, an internist, a family doctor, a nurse, all to provide care for 3,800 students. They also had 2 infirmaries, so miniature hospitals that could care for people on campus. Because remember, there were a lot of problems with infectious diseases back then, and a lot of as many vaccines as we have now. Anyway, so they were very busy, and they had a budget of $38,000. It was entirely funded by students. It was set up by students. It was the AMS Student Health Service. The university just provided the space. So we look at it today. So there are over 85 staff members working at the Student Health Service, the Student Wellness Services now. It includes, because of the decimation of family doctors, a lot fewer family doctors than we used to have. So we only have 3 full-time equivalent family docs, and I'm just ballparking that because of constant turnover of family doctors. Between Anne, me, and Jamie Adler, we make up 0.5 of full-time equivalent psychiatrists. We have 3 health promotion staff, 2 occupational therapists, some part-time nurse practitioners, over 20 counselors, 35,000 students, and we've had when we last counted 43,000 appointments, and most of those were for mental health. And every decade since 1960, there's been another crisis in student health services, trying to, and I won't go through them all. It's been quite an adventure for me to read the differences in things, but the trends are always there. There's the student activism. This comes from the American College Health Association conference in 1970. And as you notice, the students were very 1970s, and they didn't fit the margins. But they're really asking us to really dig it, man, and get moving on this sort of stuff. And I love the language because I was part of that. And then in the late 70s and 80s, a complete revamp of the health service again. And then for me, this was when I got involved. A very happy crew was incredibly well-resourced compared to the current situation in many ways. And so it goes and so it goes. And constantly reviving. Now, in 2010, there was a pivotal incident on campus which finally brought everything together. And there's a principal's commission on student mental health following mental deaths on campus. That's now been supplanted. You can't even find the document online. I tried to select the slide, but that's I came up with the page not found because it ended everywhere. But they're constantly, I've written all of the same thing over and over again. We need a comprehensive approach. And I think what Brooke and Anna are talking about is finally kind of getting back to what they said at the beginning, back in 1963, of what we need to be doing. And it's just amazing the number of resources that are available out there, but there's still lots of work to be done. And that's the Open Charter, the Scarborough Charter, and it's really not the students that's the problem. The problem is we are having a problem in providing the care to students. And that's where we need to do a lot more work.
Thank you very much, all three great presentations. I want to open it up for discussion or questions from the audience. You are still thinking about your question. I can't point to people, but I do have a question now. I'll get you to think about some. Up until recently, as you pointed out, universities haven't felt, or post-secondary institutions haven't felt that it was their responsibility to manage student mental wellness. And recently, in the last couple of years, there has been a document on a voluntary standard on student wellness in post-secondary institutions that's spearheaded by the Mental Health Commission, but funded through Bell Canada. I think it was the Rossi Foundation as well. Yeah. What's your opinion? What's your opinion on how close we are to getting to some of those standards in the standard? Are we heading in the right direction?
Well, I'm going to get myself into trouble. I would say absolutely not. I would say that it's a cycle. I think that, and I don't even know if I would agree, Heather, with the first statement, that I think what Steve's pointed out is when we've been through the history, what'll happen is there'll be advocacy and really a kind of rethink and reflection or formal review of the state of the situation, often unfortunately triggered by a tragedy or tragedies. And then there's really good work that happens, setting out standards and recommendations and getting all the stakeholders together. And then there'll be a published review, and this is what we should do. And then students graduate, the university moves on, people change positions in the university, and the memory gets somewhat lost or changed. And then there's the next problem for the university. And so I think that there's been periods in history where the university has realized that, you know what, of course we're not going to duplicate the healthcare system. That's not what we're here for. But that said, we do have a role to play in supporting student well-being and mental health. And we are a community. And actually some universities have extended that to support faculty well-being and mental health. But then that sort of goes quiescent until the next wave of unfortunate tragedy. And we have really good models, really good evidence. We know what works. It's not new, right? And then all of a sudden the politics in the model changes and we find ourselves advocating for the exact same thing, which is what we're currently doing. So it's quite frustrating. I think we need to be together. We need all the people at the table. We need a collective memory so that when it's like politics, you know, you do 3 5-year terms and then, so we need somebody to keep the collective memory and momentum going. And, you know, we can't find that review that a lot of resources were put into play to publish that review in 2012. And parents were part of that too, who lost students here at Queen's. And we have an obligation, and now we can't even find the review because it's not politically people are moving on to other things. And so I think that's the problem, and I think we need to really continue to advocate for evidence-based. There's lots of different initiatives and resources for students out there, lots of really good work being done, but it's not coordinated and integrated, and it's not necessarily evaluated, and that's where the problem was.
Yeah, I think, with respect to the standard specifically, I think one of the biggest challenges with the standard is that it's, first of all, it's like 200 pages long, and I say that scathingly as someone who's involved in the writing of it. So it's a very long document because I think there was such a collective effort to cover all of the bases and all of the possibilities and check all the boxes. But then you hand that over to an already strapped student wellness services, and they're like, holy crap, this is 200 pages long. How are we ever going to get the resources to do this? Which brings me to my next point, and that is that people are, as Anne said, it's voluntary, but no one's provided with funding to get those things done. So it's sort of like handing somebody a gigantic list of things to do without giving them any resources to do it with. And the only guidance they have is the paper document in front of them, right? So I would agree with you that we do need to do better with collaboration and partnerships and working more as a collective team as like post-secondary student mental health rather than student mental health at Queen's and student mental health at Concordia and student mental health here. There are lots of people out there that are doing really fantastic work, but there isn't a lot of communication across those channels. And I think that's where things would be made a lot more powerful if we were less, put things less close to the vest, if that makes sense. People have sort of a tendency to want to like keep their thing close because it's working for them, and that's great, but think of the impact we could have if we shared it more broadly.
Yeah, what they said. Yeah, I think one of the things that I've come to recognize is that the important role of student activism and making things happen. And the problem with student activism though, making things happen is that they're here for 4 years and then they go. And then the passing of the torch doesn't always go so well. And I think that creates some of the cycles we're dealing with now. I can remember very active, engaged student governments, and then they turn their attention, the next generation turns their attention somewhere else and things language because the pressure has to keep coming. One of the things though that's really helping now is that we have more data than ever before. I think that's been one of the big problems we've had in the past advocacy is we just didn't have the numbers. And it's much harder to argue with the numbers when we present them. And so I'm hopeful that will make a difference. But I think one of the things that has also struck me is that when there's an economic crunch, usually those crises that I was listing there usually coincide with the university having a financial crisis and saying, where can we save some money? Well, let's cut student health and cut a lot of other places too. And every time that happens, we lose something in the process. And it's a challenge in how to make the most out of the fewer and fewer dollars that people have. And that creativity is really something else that we need to find.
Comments from the audience? So I do have another question. You said student advocacy is so important, collaboration across universities. And what can the students in this room do if they want to make a difference?
Well, that's a great question. I think, you've heard about a number of initiatives here at Queen's that are hopefully going across the country and across internationally. Get involved. If you're interested, contact us, get involved. Look out the clubs and associations. There's numerous clubs and associations across campus that you can also get involved in and just be part and really have an active membership in your university. I feel like students, it's tricky because you're always feeling like you don't have enough time already for your academics. But there was a time I remember too when it was more maybe prominent that university was about university life, and it's about a balance and it's about a community, and so get involved with your community. And I think that will help your own well-being, but it will also certainly help other students and help move the needle forward. And I think it'll put, it's not only universities collaborating with other universities. I've actually found that easier than collaborating within my own university. So I think we all have to collaborate within the university as well. And having students across programs, interdisciplinary students really drives that. I think that's really awesome. So even in your academic programs, if you see opportunities to collaborate with across campus, you can get your faculty supervisors say, hey, I'm really interested in this area. Can we put that together? And that really will then push the agenda for those faculty members to actually reach out and talk to each other. So, and when we started You Flourish, actually, I met with Dr. Stoner's predecessor, Will Pickett, and we sat and had lunch at the graduate student center, and we just, sort of spitballed and brainstormed about what we could do and what we should do. That was feasible. And it's those kinds of creative moments where we really can do more with very little. And I think it's like healthcare in general too. I don't think it's about more resources necessarily. I think we're all cash strapped and there's deficits at the university. But I think we could do a lot more with what we have if we all work together. And I think students can really drive that as well.
Do you want to comment?
I was just thinking about one of the options that's also available is working with a peer health counselor, becoming one of those. Much of the work of the student wellness service is now done by volunteers and going out to residents, going out to various things, generating all kinds of cool ideas, bringing their dog in for dog petting days, everything like that. All those things add up and make a difference. And so you can all think about those kinds of options as well. I know that for me, I got involved in something equivalent to the counseling service, and that may be something as well you want to perhaps take some extra training there and get involved. And again, that's been a great resource in supporting students in difficult times. And sometimes it's just more like sitting next to somebody in a lecture hall they haven't met before, saying hello and breaking down that. Because I think one of the things we found, and what I think that goes a great loss at this university as it's grown larger. Remember, it used to be 3,800 students, now it's like 35,000 students. It's become more anonymous. And people just pass each other, and there's not an acknowledgement of the person sitting next to you. And sometimes that simple hello to someone else can maybe change their whole day around, and maybe change yours as well.
Yeah, I would agree with that.
I was thinking too about not just about the clinical experience that we have with students who come to see us, but also the data supports it, that feeling connected, feeling welcome, feeling part of a place is so important. And we do our best work when we feel that way. So it might feel like an effort, it might feel weird, to kind of reach out to the person beside you, but it makes such a huge difference. And it gives you a richer experience whilst you're here. So.
I think we're coming close to our close. So I just want to wrap up with, did you want to say? Oh, I just wanted to wrap up with some statements that a lot of the work that I've done with different organizations has been around helping them understand when it's okay to intervene. People tend to feel that they don't have the right to question a colleague or another student, and they sort of back off. But every time there's been a suicide, you talk to the people, say the residents, and they noticed something was wrong, and they didn't intervene, they didn't do anything, in part because they didn't know what to do, but also in part because they didn't feel that they should, that they're poking into somebody else's business. And so a lot of the work we do is trying to give people license to poke into other people's business when they think something is wrong. And you have to ask people, are you okay? Professors can do this too. When we know this marks dropping or people not coming to class, we can say, what's that? Is everything okay with you? I know this is not like you to, miss so many classes or for your marks to drop. And many times you'll get, oh, everything is fine the first time. But if you persist, I really am concerned. I've noticed a change in you. Well, how can I help? I think it's important to take that license and try to support your colleagues and your friends if you notice something is amiss. And I think the second thing that you need to do for sure, you know some faces now here that are attached to services that are important, but I think you should take some time and just really make yourself more aware of what services are available on campus for students and student wellness. And so that if you do have a friend who turns out to be in crisis, you know what to do for them, you know where to go, you know how to help them. And take that responsibility on yourself. And there are different programs you can take if you want to up the ante a little bit. But I think just making yourself aware of what's available and how to have a conversation with people. And just as simple as, I've noticed you're not yourself lately. What's wrong? Can I help? Let's go for coffee. Let's go for tea. Are you feeling stressed out? Can I help? Is there anything we can do to make that better? And in yourself, if you notice that you're overly stressed, that you've come to a point where you're not functioning in the usual way, that your academics are suffering, your social life is suffering, please do something about it. Tell a friend, get some help, approach one of these people here and find out what you can do. And I really would encourage you to take a look at the website Brooke talked about. It's full of stuff, full of good information about what you can do and how to approach your colleagues and friends and how stigma plays into things and what sorts of things you could expect to see in terms of symptoms. And so that's a valuable resource, and it's been successful right across Canada now, isn't it? Yeah, so please do that. So with those few words, I just want to thank our panelists for coming and opening up this conversation. As I say, you're going to be going into a very busy time in your life. Stress may be a factor, and just know that it's okay to approach a service, to approach a colleague, to approach me, a faculty member that you trust, and to be able to do something about it. And having said that, I think I'll close the session and thank you very much for your participation.